When you hear colon cancer screening, what comes to your mind? A long tube? A day of prep? Being put under? Here's the thing, you have more than one option. But no one breaks them down clearly, so people delay or avoid it entirely. This video will fix that. We are going to compare colonoscopy, FIT, and Cologuard side by side. You'll walk away knowing which test is right for you, when to start, and how to take the process way less stressful. Let's simplify prevention. Colon cancer is slow growing. If you catch it early, it's stoppable. And if you catch it very early, you can even prevent it. But only if you screen on time. The problem? Fear, confusion, and not knowing where to start. So in the next few minutes, I'll make this super simple, what test to take and when. Let's start with the basics. First, the FIT test. This checks for hidden blood in your stool. You do it once a year. It's at home, no prep needed, and it detects, not prevents, colon cancer. Then there is Cologuard. It looks for blood plus DNA mutations. You do it every 3 years, also at home, no prep, and it's a bit more sensitive than the FIT. And finally, colonoscopy. This is a direct visual of your colon. It not only detects polyps, it can remove them on the spot. You do it every 10 years, but it requires prep and is done in a medical setting. So let's recap. FIT is the simplest and the cheapest. Cologuard is more sensitive but also more expensive. Colonoscopy is the most thorough but also the most invasive. So how do you pick the right one? Let's break it down by risk level. If you are low risk, maybe you're 45 or older, no symptoms, no family history, start with a FIT test. It's a simple, you do it yearly and it catches most early signs. If you are medium risk, maybe you have had mild symptoms, aren't sure about your family history, or you have had past inflammation, maybe Cologuard might be a good fit, or talk to your doctor, especially if you had unexplained fatigue, anemia, or recent change in bowel habits. And if you are high risk, maybe you have family history, past polyps, inflammatory bowel disease, or symptoms like bleeding, you likely need a colonoscopy. It doesn't just find polyps, it can remove them before they become cancer. One important reminder, current guidelines say that start screening at the age of 45, not 50. And if you are under 45 but have symptoms, don't wait. Now let's address some common questions. Isn't colonoscopy the gold standard? Yes, but gold isn't always the best step. Isn't Cologuard more accurate than FIT? Also yes, but it's more expensive and lead to more false positives. Can't I just wait until I have symptoms? Please don't. By the time colon cancer shows clear symptoms, it may already be advanced. Screen early, screen smart. So not sure which test is right for you? Use the Gutsphere app. We ask about family history, symptoms, and lifestyle, then guide you to your best fit option. You can also use the app's tracker to log symptoms, bowel changes, and prep questions for your doctor. Prevention works better when you have a plan. And let's be honest, most of us avoid this because it's scary, embarrassing, or just overwhelming. I've been there. But the real danger isn't the test, it's the delay. Colorectal cancer gives us a 10 to 15 year head start. But every year you wait, that window shrinks. If you remember only one thing from this video, the best test is the one you actually do. Start there. Decide now, act soon. Don't let confusion become regret. You have got options, you have got time if you start early. And now you have got clarity. Download the Gutsphere app, track your symptoms, and share this with someone who's been avoiding their appointment. Colon cancer is beatable, and let's make sure you never face it too late.